That's right, Steve. The other side of the street, the other side of the story, so to speak. And I will tell you that the number of picketers has gone down a bit with this strike now in its 12th hour since starting again at 6 a.m. But again, you've got the CWA nurses as well as technicians, clerical staff, nurses' aides, and a variety of other hospital staffers who they represent out here on that picket line. And again, this afternoon, after we heard from the CEO of Catholic Health, Mark Sullivan, talking about in particular about their staffing proposal, some back and forth here as well with dueling press conferences, as you were, just like the back and forth negotiations, though those negotiations on hold for now. The union, as expected, as we're pointing out, firing back at the claims of Catholic Health's leader and saying they've been trying to resolve this for months instead of the final hours. They stress again they're prepared to talk again when necessary, again raising those now familiar points of wages, where they said they were to be close really in terms of trying to reach a settlement on the wages, but also they're trying to work out a situation with guaranteeing supplies and condition upgrades like cleanliness in the hospital. And then again, that primary point, staffing and scheduling of nurses and other staff who they say are overburdened with patients and just burned out from the pandemic and regular care.
We're hearing from Mark Sullivan today, now that a strike has started, that they came in last night and thought they put everything on the table that we needed. Well, I'll tell you what, that's bull. We have been bargaining with them since February. Our first staffing proposal got put on the bargaining table February 26th of 2020. You cannot come in the night before a strike starts and make your first serious proposal on staffing. Make no mistake about it, if the federal mediator calls us back to negotiations and says this is when you need to be there, we'll be there.
Again, you're hearing there that she is saying, that's again Deborah Hayes with the CWA, that federal mediators are now involved in this labor dispute to try to see if they can resolve this. Finally, I asked her how long you think the strike could go, and naturally the answer is as long as it takes to get what they feel they need. Again, the union has been claiming, saying that they are really patient advocates in this situation. That's why they feel they've got to get that staffing ratio down so that patients are protected. And we'll point out, as long as this strike goes, it's going to be tough on the CWA, on the hospital, the Catholic Health, and also on this community. Let's face it, some strikes up in Massachusetts lasting as long as 7 months, others in California and LA only lasting a day or two. Hopefully this strike to be resolved soon. We'll see. Reporting live from Mercy Hospital, I'm Ron Plants, Channel 2 News. Back to you, Mary Alice.